Let's get you the latest as far as the COVID situation in the state of Kerala is concerned. Remember, the state has been witnessing a surge in COVID cases, and for the third straight day, Kerala has logged over 22,000 fresh COVID cases in a single day. As a result, Kerala government has imposed a complete lockdown over the weekend starting July 31st. A 6-member team headed by Director of National Centre for Disease Control has been sent by the centre to Kerala. The expert team will study the situation and suggest measures to contain the outbreak. Meanwhile, the centre has advised states to conduct their own sero survey. This as the national sero survey results do not properly reflect sero prevalence between districts within the states. As per the national sero survey, Kerala has the lowest sero prevalence of 44.4% as compared to other states. All right, and as the cases are rising in Kerala, the next expected thing that's happened is politics over COVID surge in the state. Now, what's happened is half of India's COVID cases are coming in from Kerala alone. The centre and the state are locked in a battle over COVID management. Minister of State V. Muralidharan said that Kerala's COVID management formula has failed and that the state government didn't follow scientific principles issued by expert bodies. While the Kerala government hit back, claiming that this is a planned conspiracy against the state that has consistently fought the virus. And Kerala government also said that especially when experts around the country have lauded Kerala's efforts in combating COVID, this kind of criticism from the centre is unwarranted. Kerala Health Minister has also gone on to say that the state's defence mechanism against COVID is very good.
The government didn't follow the scientific principles in the management of COVID. It's a global pandemic. The WHO has issued guidelines, ICMR has issued guidelines, but the Kerala government has taken a stand that no, we follow our own principles and our own formula. And now it has come to light that that formula has failed. So the government should follow the scientific principles, scientific formula, one. Second is, Kerala government has been using this pandemic for political gains. The relaxation that was given on the occasion of Eid, that was completely unscientific, that was completely against principles.
There is a plan to campaign against the state, I think, the Kerala state, because as you all know, all the experts in different states say that we have a very good system or we have a very good defensive mechanism. The seroprevalence study conducted by the ICMR shows that the number of people or the percentage of people who have antibodies in their body is almost around 42%, which shows that our preventive mechanism was very good, and that more than 50% of the total population is still unaffected.
All right, to understand these developments better, I'm joined by my colleague Ayushman on the broadcast. Ayushman, good morning to you. Thank you for joining us. As we know that a political war has broken out between the centre and the Kerala government over the state's COVID management. For the benefit of our viewers, could you tell us about the team that the centre is rushing to Kerala and what is it expected to do once it reaches there, because we know it's headed by NCDC. What is expected today?
Well, a 6-member team headed by the Director of National Centre for Disease Control, Sujit Singh, is there in Kerala, and they're going to visit almost 6 districts where the case rise has been significant in past few weeks. More than 10% of positivity has been witnessed in these districts. Importantly, for past few days, we have seen Kerala reporting more than 50% of the total caseload that India has. In fact, today, if you look at the past 24-hour scenario, the recovery numbers are less than the new cases which have come to light, which is a cause of concern. Important aspect is also that the centre wants the states to do their separate sero survey, because the national sero survey which they have done indicates that there is still about 66% of susceptible population which has not been through the infection, and they are vulnerable. It will be important to see how Kerala does that. But most importantly, Kerala has a better healthcare infrastructure as compared to the other parts of the country. So we are seeing a lesser mortality rate there. But other aspect is of containment strategy. The center says that they need to improve on this because the containment strategy is what they're not focusing upon. Mitigation theory is what they're working on, which means that if a patient contracts the disease, he can be treated well. But the important aspect here remains that you cannot treat the case rise in Kerala in isolation. If the number rises there, the other states, the neighboring states, and in fact all of India is vulnerable, and that's why a central team has been rushed. It will be important to see what are the findings that the central team gives and how does it aid the Kerala government, which already has been doing quite a good amount of work in containing COVID. But because of the case rise there in Kerala, definitely the scenario which we saw earlier this month when the case rise was declining, that has certainly stopped in the national scenario. And India is again reporting somewhere about 40 to 43,000 cases daily in past few weeks.